All right. Let's see. Going to send a message to everybody. All right, so I'm just testing this out, see where I'm at. I think I might be good. Let me see. All right, I got Portia in here. Tell some of your classmates, anybody. I'm doing a sound check to make sure you guys can hear me. Okay, let's see. Let's see. All right, so connection is good. Who else do I have in here? All right, so I'm gonna start. It's 1 o'clock. Hopefully, hold on one second. Yeah, I'm just sending a message out to let you guys know I'm in here. Few things. Make sure you are being safe. Let me make sure I'm looking at a camera here. Make sure that you're being safe wherever you go. Make sure you wear your mask. Of course, you've probably heard this 1,000,000 times, but it's so important just so most of us can stay here and we won't return home, because I know none of you guys want to return home. Okay. So I totally empathize with you in terms of being in the house. So just make sure you wear your mask. Be mindful of the places that you are going. You know, if you're gonna turn up, you can turn up with a mask. I know they're annoying. They're hot. They work you out, all that fun stuff. But it's just so important for us to try to get back to a little bit of normalcy until this thing is gone. But first things first, I think this might be the first time for a lot of people seeing me. I'm your professor, Miss Nesbitt. Please go on Blackboard. Oh, I see somebody else is here. If you're logging in and just logging in, make sure you hop on to the chat and let me know you're here. I'm not going to police attendance so much because everything is everywhere at the moment. Ideally, what I would like is that I would like to still hold face-to-face, not this week. I would like to still hold face-to-face courses for as long as I possibly can by providing like your basic anatomy, your basic kinese information, so you can use it everywhere else, and so it can serve as a foundation for you. So you can check Blackboard to see where these options are. Matter of fact, I will gladly show you. Let's see, as I'm editing everybody's assignments. You want to start out by going to your syllabus. While I'm looking at it, make sure that you are in your syllabus. Okay, make sure you look at it, and additionally, make sure you complete your syllabus quiz. I'm giving you until the 31st at midnight or 11:59 to do your syllabus, or the syllabus quiz rather. The syllabus quiz is in lieu of doing the back form, the student acknowledgement form. I do not want that form. I just want you to do your syllabus quiz. But additionally, you're going to click on announcements, and you're going to see all of the information in terms of getting into the Remind app, the groups that I broke everybody up into. Now, this option is still open for those who find themselves that they rather be online, either by choice or whether they're working from home or whether they chose to stay home because of COVID-19. Please let me know and I can add you to that list. That way I won't panic when I'm looking for you face to face. I'm totally open to it. Just know that the recordings will probably come a little bit later in the week as opposed to the rest of us who may have already met on Monday. Also, to be mindful that there's a capacity in the classroom. I have to stop at 15, so I think right now I'm at 14. Maybe you want to be the one to say, oh, I'll go online. Totally up to you. Just let me know. Also, be sure you hop into the Remind app. If you can't find it through the announcements, it's always going to be in your syllabus at the top. Might as well go to it now. In the syllabus at the top, where it'll tell you that information in regards to how to get a hold of me. You're going to text this, sports with an S, INJU, to the number 81010. Okay, and that is the best way you can get a hold of me as far as messaging is concerned. If you guys message me around 2-3 in the morning, it's not that I'm ignoring you. I'm asleep, so I'll get back to you as quick as I possibly can. But just make sure when you do message me, reference what you're messaging me about. Let me make sure I'm not missing any students sending me a message. Just message me what you're referencing about or what questions that you might have. We are coming up, according to my syllabus, there is a quiz that is coming up, but I'm going to be a little bit lenient with this quiz because I know some of us are still adjusting to courses, just trying to get some normalcy going. So let's get rid of these multiple million screens here. I'm just making sure I'm not missing anybody. So let me do this. All right, who else do I have in here? All right, so got a little kinks in this, little technical difficulties because I am kind of only working with one screen, but I'm hoping that'll change soon. So, but let's go ahead and get into it. I'm going to set a timer because research shows that as a student, including myself, only probably good for about 20 minutes. Okay, so I'm going to move through this pretty quickly, and then I'm going to stop, give you guys a little break, and then I'm going to go into chapter 8. Okay, so for those who have missed it, chapter 7 addresses various anatomical terms of motion. Okay, we discussed the anatomical position and planes. We've always talked that anatomical position is always your reference point in terms of determining or analyzing body parts. So, of course, we stated that anatomical position is upright or erect stance. You're facing the front or forward. Arms are out to the side and your palms are facing forward. Your palms are not down. They're not turned in by your side. They are face up. Okay. We discussed that there are 3 anatomical planes: frontal, sagittal, and transverse. Okay. And we also went over and looked at commonly used anatomical terms of motion. That's where the flashcards and the sheet of paper comes in. Okay. What you can possibly do is just take that sheet of paper. You can do what I did in 2002 when I had to learn this. You're going to take a sheet of paper. This is just a packet. Okay, you're going to fold it into 2. Okay, one side might be your terms. I'll just flip it over since it's blank. One side is your terms. The other side is the definition of your terms. Or you can always use flashcards to identify the different terms. Now, when practicing the art of memorization, by all means, please use body parts. Okay, you could use a chart online. You can use your own body parts. Just be creative. I know that this is a unique learning process, and it's a unique teaching process too. So we'll definitely all get through this together. But as I said, definitely review your anatomical terms of motion. Okay, and that is a few slides in where we went over flexion, extension, abduction, adduction. Okay, one thing that I've always said to remember, how to remember the difference between ab and adduction. Adduction is you're adding towards the center of the body, and abduction is moving away from the center of the body. Okay, flexion decreases the angle, extension extends or opens up the angle. Okay, just think about your bicep and your tricep as far as flexion and extension. And same thing with abduction, adduction. Thinking about your whole arm. Arm is your best example. Okay, we reviewed in our face-to-face meeting pronation and supination. Okay, pronation is palming a basketball. You would think of a pro basketball player. Supination is that you would always reference maybe a cup of soup. Okay, inversion is the turning of the toes in. Eversion is the turning of the toes out. And we have protraction and retraction, which I believe I may have left off, but that is okay. You want to think about your shoulder blades, okay? You want to retract or pull back your shoulder blades toward the center of your body and protract or push, kind of like someone is behind you and they're just trying to push apart your shoulder blades in terms of away from the midline. And we have elevation, and this missed depression, but it is okay. I'll update these notes for you. Depression is basically, you want to think about your shoulder blades, same thing. Elevation is raising your shoulder blades towards your ear. Depression is just dropping your shoulder blades back down into its neutral position or pulling away from your earlobes. Okay? Now, what we're going to do, we're going to talk about something slightly different. As I said, I'm going to move at accelerated pace only because I probably got, according to this, I got maybe, if my timer, what happened to my timer? If my timer is, I'm wasting time here. I got 16 minutes. All right, so your skin, okay, your body, okay, the biggest organ on your whole body is skin, okay? It holds 3 layers. Holds your epidermis, which, you know, we used to always joke when we were little kids in the 90s, your epidermis is showing. That just means skin. Okay, and then you have your dermis right below it. Okay, it's connected to a much thicker layer. And your hypodermis is the subcutaneous layer. It's the layer that's full of fat and where your blood vessels are located. Okay, this is important to know as far as tissue injuries. All right, another thing to remember as far as bones, you may or may not have learned this already, but these are the 3 functions, primary functions of the bone, okay? One of the goals is that it should protect organs in the body, okay? Keeping it from trauma, such as your skull, okay? Your skull has one main purpose, is to protect the brain, and it's surrounded by this kind of this chalky fluid called your cerebrospinal fluid, okay? Same thing with your ribs, okay? Your ribs and your rib cage, in addition to your sternum, are designed to protect the heart and lungs, okay? Additionally, your bones are designed to create a stiff structure to promote movement through muscle action. So if you didn't have any bones there during muscle actions, your muscles would just be all over the place, truth be told, okay? And the good thing about your muscles is that they're good for nutrients, okay? They produce blood cells. We've all heard of kind of like those that are donating plasma. Generally, those come from bone, okay? And as mentioned before, it stores minerals such as calcium and phosphorus. So if you haven't started already, as a result of COVID-19, like most people have, they started taking extra supplements. So I'm going to check in to see where we are. Questions. Let me make sure we're good on questions. All right, so I got 10 people here, and that's a good thing. All right, so I'm going to keep it going, keep the party going. All right, so another thing that you want to know as I'm going through this, like I said, I'm kind of periodically checking to look at the chats. And like I said, I've only got one screen, so you're going to see multiple screens until I can get one screen. You have your axial and your appendicular skeleton. Okay, the best way to remember the differences is that your appendicular skeleton is just all limbs, okay? Anything that is outside the spine, the ribs and the diaphragm and the skull, okay? Your axial skeleton houses those 3 parts of the body, okay? Your bones can come in all types of shapes and sizes. They could be long, they could be short, they could be flat. And anytime we're addressing a growth plate, okay, generally you might be talking to a child or referencing a child. Generally, when there's a bone injury, when it comes to repair, it's in the benefit to ensure that the child can still grow or their bones can still grow. So anytime when we're talking about growth plate issues, it's just referencing a minor. I don't want to say child, I'm just going to say a minor. All right, so now, here's the part where we're going to get a little technical here. All right, so you got bony prominences. Basically, those are areas of your body where your bones are probably going to be most superficial. Okay, we talked about superficial. Check your anatomical terms to see what superficial is. But if not, at your convenience when you feel like it, definitely go back and review what superficial means. Okay, superficial is closer to the surface. Okay, in this case, we're referencing skin. All right, we got your malleoli, which of course is the areas around your ankle. We're just going to go and you want to think about your patella. We all know what a patella is. Okay. Now you're going to learn this in human anatomy, your anterior, superior, okay? Go back and review your terms, okay? Anterior being to the front, superior being to the top, iliac spine, okay? That's something simple that you can feel. You can feel that with your thumb. I don't know, if you're like me, you got a whole lot of pushing to go through, but you can feel that with your thumb, your most pokiest or sharpest part of your hip, okay? Your olecranon process, guess what that is? That is your elbow. Okay, so we all know where our elbow feels like, your medial epicondyle. All right, so again, go back and review your anatomical terms. You're going to discover that your medial epicondyle of your elbow is along the inside. Okay, same thing with medial clavicle. Okay, we know that this is our clavicle, but if we're addressing the medial part, it's the part that is the most superficial portion of the whole clavicle. The occiput, right in the back of the head. Okay, right above, I'm just going to say it because I'm touching my own head, right where the kitchen is, where it starts, where it wants to collect, okay? That's where your occiput is located, okay? And you got your zygomatic arch, which are your cheekbones. All right, so as I said, as you use your flashcards, as you're reviewing your notes, okay, be intentional about touching those areas and figuring out where they are. All right, get familiar with them, especially your ASIS, okay, or what I just said, anterior, superior, okay, and also be mindful in using this term and identifying the location of anything and everything. Most times bones, oftentimes muscles are named for its exact location, okay, so always remember anterior, superior, iliac spine. Like I said, it's a lot of terms. All right, we all know about our muscles, tendons, and ligaments, okay? Your muscles do all the moving, okay? And your muscles receive those signals to move from your nerves, okay? So, and how you receive those impulses from your nerves is that generally it's a response to a stimulus. So if you're a track runner, and, if you at the start signal or at the start noise, okay, that's how fast the signal moves from your brain through your nerves into your muscle. We know to respond to that stimulus, and that stimulus generates a response in the nerves to send directly to the muscles, to the right muscles, so you can start running, so you can run your meet. Okay, tendons, they connect muscle to bone, okay, and what it does is it transmits force, okay, and your ligaments connect bone to bone, and it helps form or create what is called a joint. All right, so you got 3 types of joints, okay. Diarthrodial joints are most common and most known to be synovial joints, okay. Synovial joints have a little bit of flow to it, okay. You have some fluid in there known as synovial fluid. Okay, you have a synovial membrane that lines with inside the capsule. So, of course, in that particular joint, so there won't be bone-to-bone rubbing at any given point. You may have heard in older citizens where, there might be an issue of they feel bone-to-bone rubbing together. We'll get into a little bit of that, but oftentimes it could be a lack of synovial fluid for maybe an injury or overuse. But again, we'll get into overuse and injury later on. Okay, so we have your hinge joint, which basically is your elbow and your knee. Of course, you can't see my knee. Okay, and any joint that can move in multiple planes, which is multi-axial joints, shoulder and your hip. Okay, shoulder and your hip, most common term we use for that, ball and socket. Okay, when we think of hip bone, we think of it being some sort of, or at least I did. I thought of it as some sort of weird mechanical function. All it really is that it's your hip with your femur, okay? And that is all it does, all right? That is considered your ball and socket, okay? If anybody, it probably is a little bit advanced now, but if anybody wants to watch an old school hip replacement, be my guest. Google it, YouTube it. They used to do really wild stuff with hip replacement, but now I think it's a little more sophisticated now. All right, two other joints. Here you have your inferiorthotibial joint, okay? Those are the joints that really connect two bones together, and there's not really a lot of movement with the exception of a knee. Like, for example, you have your rib cartilage kind of joining the ribs together, okay? That's why you might hear people say, you know, my gosh, you know, a broken rib really hurts. It really does, because oftentimes you're really in those joints, and it can take a while to repair. Okay, and we'll go into the rehab portion momentarily later on in the semester. And you have your synoarthroidal joints. Okay, those joints are not moving whatsoever. Okay, so if you break something in the leg, woo. Okay, for example, you have your tibia and your fibula in your lower leg. Okay, you'll notice that those joints are not moving. As opposed to you moving either a tibia or a fibula, you move the whole leg. Okay, they don't separate, they don't move. It's designed for that to be as a form of support on the femur. All right, so we have some muscle tissue to go over. All right. Of course, you want to think about the involuntary muscle tissue, all right? If you don't remember anything else, always remember that your heart is always cardiac muscle, all right? Oftentimes it is smooth. Well, intestines and organs and blood vessels tend to be smooth muscle, all right? So cardiac muscle, that means it's involuntary, it has its own set of neurons to operate through. Rightfully so. You need your heart, okay? You have your sphincter muscles, which reduce the size of an opening based on a stimulus. Like your stomach is going to respond to food. Your eyes are going to respond to either eyelashes or someone coming towards your eyes. Those sphincter muscles are designed to respond to a stimulus. Let me go into the chat. Yes. Slides are on Blackboard. All right, so questions. Yeah, you're going to see unfortunately, the screen where I'm chatting. Only because, like I said, I only got one screen right now. I'll remember to bring two if we do a live session again. All right, ladies and gents, I think we're Gucci. All right, so now what we're going to do, I'm not going to cover too much into your muscles because that is sort of kind of goes deeper into kinesiology, okay? But your prime movers are your agonists. You always have the main muscle that does the majority of the movement, all right? So as we talked about before, we talked about bicep and the arm flexes, and the tricep does the opposite movement, okay? Side note, while I believe I have some of my students here who, all right, so I believe I have some of my students here where we talked about planes. Figure I put that out there, where we talked about different planes. We talked about the transverse, the sagittal, and frontal. And we talked about what plane is a bench press on, all right? So, drum roll. You guys did look it up. It was transverse, right? So it took me what set me back. I'm thinking I still don't understand why bicep or why is a bench press transverse. Like I said, any movement that occurs parallel to that imaginary line, a bench press moves parallel to that transverse line. As I said in the beginning, you know, I love learning. I am a learner myself. As a professor, I'm still human. I don't know everything. So, but we talked about planes and how to use planes. Planes are always just a frame of reference as far as training is concerned. Training, and you're talking to your other colleagues, you're talking to a mentor, you're talking to maybe another medical professional. That's where the use or the reference point of use of planes are important. So we'll go back into the slides. All right, so your muscles do have origins and insertions. Okay, we talked about the difference between proximal, closer, distal, further away. All right, if you have not looked at those anatomical positions, please go back and do it now. All right. And as I talked about it before, proper terminology regarding movement is so critical, so important. It's so important as far as your colleagues are concerned. It's very important as far as maybe you're talking to a medical practitioner. You're not going to talk about transverse plane to your client if you might be personal training or you're a physical therapist. You're not going to mention that. So, but it's a good reference point for you to use in terms of knowing. All right, I'm seeing some people come on in. Yes. So just make sure that you go in there and review the planes. What I will do, let me make sure I'm not going over my time, because like I said, people get, all right. So what I'm going to do is I'm going to pause for the cause for a second. I'm going to wait for any questions about, because what I'm going to do is that I have to break this chapter up, because I'm pretty sure people are going to be so, I don't want to watch 20 minutes of this. I'm not on my computer, so different name pop up. Got it. All right, so while I'm taking a small break from talking about chapter 7, I'm going to address, like I said, the housekeeping things. Make sure that you go in and complete your syllabus quiz. That syllabus quiz is to be done in lieu of you turning in the back part of your syllabus, which is the student acknowledgement form. I do not need that, okay? Now, you can hold on to it if you choose to, but I need the syllabus quiz done, and I need that done by the 31st. So please go in there, do your syllabus quiz. Make sure you go into the Remind app, download the Remind app, and reach out to me. Like I said, if you send me a message at 2 in the morning, it's not that I'm ignoring you. I'm asleep. So same thing with emails. I promise I'm not ignoring you. I'm probably just really sleep. I don't really hear anything once I'm shut eye. So trying to make sure I got everything. The submit time. Oh, talking about tests too. Submit time you'll see on your syllabus, which is so important for you to download. Make sure that you download your syllabus just to keep and use as a reference point. You're going to see where the syllabus the week will end on a Saturday. And that's fine. I just want you to be mindful that any assignment that you turn in will be the following Sunday. So let's say the Saturday is the 2nd, okay? You would turn in your assignment on the 3rd by 11:59, okay? So in addition to that, I think this is very important for everybody, because I think I told one class, but I didn't tell everybody. I have some new people on here who weren't able to come at all last week. Just so you know, I do grade on a curve, okay? So, for example, if the highest grade in the class is a 98, I will subtract that from 100 and give everybody an additional 2 points, okay? So that's how I grade. All right, now that does not call for somebody to do a 60 and the test as the highest, and then I have to curve you 40 points. That's not good, okay? So still do your best. My tests aren't that hard, so they're not, I would say on a 1 to scale, I would give my test maybe about a 8. So they're not that hard. But that's just a few housekeeping items. Make sure you go check out Kentucky State University's information about this week and a lot of their safety practices in regards to COVID-19. Make sure you wear your mask. I got mine. Make sure you wear your mask, wash your hands, bust out your hand sanitizer. Okay. New normal. I know. So, anybody in the chat got questions? Somebody talk to me. Let me know, are we good? Everybody in the chat, let me know that you're good. And you can just say, oh yeah. You can be real simple with it. Just let me know you're good. And then we'll go over chapter 8. Chat boxers, are you good? Just waiting on everybody to say, oh yeah, in the chat. Nobody's saying, oh yeah? Nope. Okay. It's all right. All right. Yes. Thank you, Brianna. Thank you. Let me know that I ain't by myself. Like I said, just let me know that you're okay. You give me thumbs up. You can say I'm good. Yes, thank y'all. Ooh, I was about to say, did everybody log off? I was about to be scared. All right. So as I said, right now, kind of working on just one screen at the moment. So you're probably going to see like multiple things. I apologize. I'll do better. I gotta get a connection for my laptop. So, all right. So let me see. We are gonna go into chapter 8, which is and you'll notice that I have reorganized your learning modules. Okay, so they're specific to each week. I'm gonna give you guys a little insider, and you might notice this in multiple classes. Yeah, I give you guys a little break right here in week 6. All right, so to make sure you guys are still with me, can I get a oh yeah for the break? All right. Yeah, just giving you guys a couple of minutes before we just hop on in here. And then I'm doing that for editing purposes as well. So, but we're going to go back to module 1, week 1. As I said, I'm organizing it just so it could be much more functional for you guys. But going into chapter 8. All right. Now, you're going to need to know the basics of every tissue injury. That's where the sheet of paper, fold into 2, cheat sheet comes in. All right, specifically when we're addressing things such as wounds. All right, so I'm not going to read this PowerPoint to you. Most of these terms you have heard of. Additionally, I'll put up more information in regards to, I won't get graphic. I think for a lot of these pictures that might be a bit much. But you must know the difference between an incision and a puncture, an amputation, and a laceration. All right, we'll get into how to treat those things later on. But at this point in time, and I say this again because the quiz is coming, okay, make sure that you know and get very familiar with these terms. Take a little time, print out this section and write it out. I know with this online learning concept, I know it can be hard to just learn stuff and get to know what things are, but the best learning tool that I've ever adopted is just to write it out. I know you got to get paper and pen and all that other stuff, but print it out, save it. It is in your module posted on Blackboard. All right, so just to go right into it, okay, you have sprains and strains. Okay, we always want to know what the difference between sprains and strains are. Okay, strains, you'll know what a strain feels like. It is brutal. It is a muscle spasm like no other. But a sprain's a little different. Okay, you're gonna tell that there's some injury to some blood vessels because of bruising. Okay, you'll turn. Sorry, I'm still getting emails. You will turn purple. You might turn blue, only because of the bruising that occurs at that particular point. Okay, so wounds are just straight up injury to the skin, but you do have either open wounds or closed wounds, and generally closed wounds are essentially a bruise. Okay, as I said, the skin will either look red or purple or blue. Is there anybody in the chat? Yep, I'm gonna participate with you guys. Is there anybody in the chat? All right, good. Is there anybody in the chat that bruises easy? I bruise so easy. I'm the person that will run right into a piece of furniture, and then 2 weeks later, there's a funky looking bruise on me. So basically, that's what a closed wound is. All it is just it's just closed. It's underneath the skin, but there's some damage to some blood vessels. All right. So, okay, there's different techniques to close it. Anybody go ahead in the chat, go ahead and say that they had stitches before. I can't, well, yeah, I have. Yeah, I've had stitches before. I'm kind of a klutz. Okay. Stitches are just medical grade sutures that are like your skin is being sewn together. Oftentimes they occur when there's bone that's exposed, or you'll see under the third layer of skin, your hypodermis that's been exposed. That's when stitches occur. Okay, you might just close your skin up. Okay, it just might be some tough medical grade material that just closes the skin solid. All right, either way, I have not seen too many tissue adhesives, just primarily stitches and skin closures, just kind of like some butterfly tape. I really haven't seen anything else, but if you guys have, man, oh man. Okay, Kayla, I know you have. I'm just kidding. I might have to, okay. I was going to say, Kaylee, I'm going to have to use you as my resident medical technician. So, sorry about the noise. Yeah, they're going to talk. So, all right. So we're going to go ahead and let's talk about sprains, okay? Like most injuries, we're just going to go scroll down to your PowerPoint where it talks about classifications, okay? You got grade 1, grade 2, and grade 3, okay? Grade 3 being obviously the most severe. Grade 1 could be something that it can be mildly treated. Usually, grade 1 injuries it could be treated by someone who might be there, who might be the professional to take care of it, such as your... let me see, maybe a personal trainer, maybe a fitness specialist, might be a professor, that type of ordeal. Let me see. All right, whoops, past that. Same thing with your strains. There's 3 classifications. Again, 3rd being the most severe. At that point, you need to get a medical professional involved. Grade 1, sometimes you could get, the professional that is there involved. This is particularly important to know the differences because you might need to know who you need to get in contact with or who you need to reference that person to in order to get treatment. So, okay, if they have something that is a grade 3 where there's no movement and there's no function, that's not something a professor can do unless I was an MD, and I am not an MD. So just be mindful of that. Generally, a physical therapist might be able to go into a grade 3. I believe, but usually a DPT, a doctor of physical therapist, can go into grade 3 injuries. They could treat it. Oftentimes, you'll always come across an MD or an athletic trainer. All right, so we have nerve injuries. Like I said, I got to check on y'all to make sure you're good. All right, so making sure we're good. Like I said, I have to apologize for the multiple screens. This should only be temporary. All right, so nerve injuries. You can tell when there's nerve damage when there's an alteration to kind of like that, what is normal function of the nerve. It might be painful, might not feel any touch, you might lose some sensation, but your nerves carry so much function in addition to communication. It transmits pain, transmits touch, transmits heat, cold. So anytime there's an injury to a nerve, you tend to lose those senses a little bit, okay? So we talked about neuroma, okay? Now, we'll get into suffixes and prefixes later, but this is another quiz question, okay? Oma means enlarged, okay? This is one of 2 terms that I'm definitely going to put on there, okay? Oma, O-M-A. We got it? I know you guys got it. You guys are smart. All right. So now, another term, inflammation, okay? Doesn't mean after we had like some wings, doesn't mean that term after we've had Big Ma's cooking or Me Ma's cooking or my mama's cooking or anything of that nature. It means inflammation, itis, I-T-I-S, all right? So be very mindful of that term. We also, now I get picked on a lot because I say fascia. Some people say fascia. I say fascia, okay? So it's thick, tough connective tissue that surrounds the muscle and helps to loosely bind the skin to the underlying fat and muscle. Okay, we talked about myofascial release. Okay, we talked about foam rolling. Those are the things that we think of when we we think of trying to release the muscle or release the fascia, okay? You might get a massage to help release the fascia. Like I said, it could be fascia, it could be fascia, potato, potato. It's the same thing, but I want you to use a term that is that you're more comfortable with. Okay, and we talked about itis, I-T-I-S. Okay, we have fasciitis. All right, it is inflammation of the fascia. So anybody references any type of term that you're not sure what's going on, and there's I-T-I-S at the end, know that it's for inflammation of that particular body part. Some body parts have different names, but know that there's an inflammation going on with that. Okay, we talked about soft tissue injury with bursa. Okay, bursa is just basically a sac of fluid. Okay, it's just it serves as a shock absorber, kind of like when you worked on like maybe a floor, and they always put like this shock absorbent rug underneath your feet. Okay, all it does is it serves as a shock absorber. So you might I know I have heard my grandmother say this, oh man, I got bursitis in my knee, got bursitis in my shoulder, got bursitis in my back. Now the back part I don't know, but the shoulder and the hip and the knee, yes, you do have bursa sacs in those areas. Okay, and bursitis can happen, as we talked about bursitis being inflammation of. Okay, it's an overuse injury. All right, so generally itis usually follows after that body part, and it's a result of overuse. Let's see here. All right. So again, I'm not going to go too deep into it because I'm about to max out on the amount of time you guys have my attention span. We're going to talk about the stages of healing. Okay, it depends on the grade, whether it's not grade but stage rather, stage 1, stage 2, or stage 3, or you can use grades. For some body parts, it might have gone through a severe impairment. Or a severe injury or removal of its particular function or use, might be subject to remodeling, and sometimes that can take an extended period of time. And as you're getting ready to work with children, work with clients who come in for physical therapy or occupational therapy, that's really you guys come into that role and really help that person rebuild or regain function in that particular area, because there's been some severe remodeling going on, and generally as a result, sometimes for some, remodeling can take up to a year. It's a process. Now, I know we're going to talk about this. You're probably going to hear this for about 5 years after all this, but right now, and I encourage you to look up on your own. First off, fitness does play a significant role in terms of COVID-19 because it helps with mental stability. You're wondering, like, why is that relevant? Okay, because oftentimes we forget about like our physical therapists. Oftentimes our physical therapists help those who've been severely impacted by COVID-19, who've been in the bed for weeks or months as a result of COVID-19, and physical therapists help them to regain movement back into their body, because obviously, those with COVID-19, they've been sedentary for so long in a hospital bed, hooked up with ventilators and IVs. So physical therapists play a very critical role in the COVID-19 process. So if you know a physical therapist, thank them, high five them. They are definitely our frontline workers for sure, as well as our nurses. So in addition to you thanking your physical therapist, go thank your nurse Todd. But as you see me clicking through here, highlights the different stages of healing, okay? And I want you to definitely review those. Now, it's not going to be on the quiz, but it will be a test question. All right. So I don't want anybody to be terrified of the quiz. Your quiz is there to just kind of help you test your knowledge and making sure that I'm doing my part, making sure that all the tools you have available are on Blackboard are current and relevant. Okay. Now, we're going to talk about something that is very important, and I've vowed this particular semester that I talk about it more as someone who is in this profession who identifies as an African-American woman. Now, when we talk about differences in ethnicities and differences as far as individuals and different races are concerned, be mindful that a keloid does occur more in African Americans. All it really is just excessive scarring, okay? And it it can occur in layers. Sometimes maybe you may have had an injury on your arm, maybe you've been burned on your arm. I actually, like I said, I'm a little bit of a klutz. I actually used to jump fences. I'm not that person anymore, but I used to jump fences as a kid, and I actually got caught in a fence, and so I do have a little small keloid on my kneecap as a result of when I used to jump fences back in my backsliding days. But oftentimes when we see different injuries that are different based off of the person's ethnic background, sometimes we may not know how to treat it or what's going on, or we kind of treat it, a little differently, and we might make that particular patient uncomfortable. Just know that keloid is just excessive scarring, and sometimes it can delay healing. Some keloids are severe enough where it might immobilize some parts. So but keloids generally are surgically removed, but it just happens in very rare cases. I'll use my mom for example. I know she hates being used as an example. My mom had a cesarean scar. I had to be the one to bring the cesarean scar, but with my youngest brother, she actually had some form of corrective surgery to get rid of the keloid. So she still has it, but it went from being this long to probably about that long. So all it is just excessive scarring, and you might come across that primarily more in African Americans. Okay. What impacts healing? I've worked with athletes all the time. I probably got another 5 minutes. What impacts athletes all the time in terms of healing is concerned, you want to make sure that they do rest. By all means, I probably need to put that on there. Rest. Okay. Follow the instructions from the provider, from the PT, from the fitness specialist, from a professor, from your coach. Follow their advice. All right. Age does play a role. Okay. Illness also plays a role. Okay. Be mindful if the student or the athlete is a diabetic, either type 1 or type 2. Nutrition. You might hear this a whole lot. Nutrition plays a critical role, not only in just a athletic injury, but in almost every injury and illness. Okay, what you eat and what you put in your body will determine how quickly you'll bounce back from something. Okay, and of course, most importantly, degree of injury. If of course, obviously, if I break my femur, just because I ate greens every day, that doesn't mean my femur is going to heal in a week. Okay, that's just realistic. But of course, if I were to break my femur, that's pretty severe because that is a pretty large bone. Okay, so those are just some minor factors that play a role in healing. All right. So without going into further review, but I will put up different tips about the types of bone injuries. Of course, we got a dislocation, basically just when the two bones don't line up anymore, just based off of impact. And we talked about, briefly talked about what a fracture is. Okay, fracture can be found in your book in greater detail on page 83 through 85. And you may have had a splint before, just in case you broke a bone. Oh, here comes the torture pictures. OMG. All right. So we've all seen it before. How many of us remember this particular injury? Oh my gosh. I think I panicked when I saw that. So that's what you're going to be looking at. And that's one of the ways that you're going to tell, oof, that just gives me the heebie-jeebies. You're going to look at spine information. Oh, I can't even think anymore just seeing that. Oof. So how are we doing so far? Think we're good? Think we're good? Think we're good. Making sure I still got people in here. I think I still got people in here. I might have people in here. Yes, I got 9 people in here. All right. So what I'm going to do to keep from rambling, I'm going to end it here. What I'm going to do is that your PowerPoints are up. According to the syllabus, I'm supposed to give you guys a quiz by the end of this week. I will post the quiz by the end of this week, but I will not have it due so soon. I think the turnaround time I'll give you about a week. So yeah. So just making sure some of you guys are still in the chat. I got good. How are you guys doing? Can I get a oh yeah? Brianna said, oh, yeah. Sasha Bill said, oh, yeah. Oh, technology, boy. Technology is interesting. We got to get real used to it nowadays. So, yeah, I'm going to stop here because, like I said, I'm on average watch time being 20 minutes. I totally understand that you got other things that you got to do. You might be in a online activity through KSU. If you want to review this, I will leave this up. I will put up an additional video about kind of like our semester-long project in this course. But outside of that, I will leave you guys to enjoy your Monday afternoon, okay? I will chat soon. See you guys later. Just looking for a response in the chat. There's a delay there. I think so. All right. So, like I said, we'll holler at you guys a little bit later. Like I said, later on in the week, I'll put up additional videos, additional content. These PowerPoint slides will be up. All right. I will see you guys soon. Peace. Oh no, I'm glad I didn't do that yet. No class Wednesday, Solomon. We're good. But I will post a video. That's not a live recording. You would just see the video. Sasha, yes, come on over. I'm here. I'm here till about, give or take, 3:15. Just making sure that I caught everybody. Now, yes, if you guys have any questions, please don't hesitate to message me, email me. I'm here. Like I said, I understand this online experience is unique. I'm actually going to continue to do YouTube Live because it works out better for me because that Blackboard Collaborate is intense sometimes. Okay. All right. I'll chat with y'all later. Peace.